Thank you all for joining us for today's QC COVID-19 press briefing. Today is Tuesday, and we're going to go ahead and get started. With us today, we have Janet Hill with the Rock Island County Health Department and Amy Thorson with the Scott County Health Department. So we're going to go ahead and get started today with some of our numbers. Please go ahead, Janet.
Hi, everyone. We have a wonderfully low 4 new cases to report today, bringing our total to 13,129. We have 13 hospitalized, and unfortunately, we have sad news to pass along. A man in his 70s who had been hospitalized has died from COVID-19. We send our sympathies to his loved ones, and his death brings our total to 306.
In Scott County, we've had 18,630 positive COVID-19 tests, which is a 4% positivity rate over the last 7 days. And we have had 219 total deaths of Scott County residents.
Okay, Janet, can you provide us some of the prepared information that you have?
Sure. Almost everyone we've talked to at our mass vaccination site at the Camden Center in Milan has been impressed with its efficiency. We are grateful that Governor J.B. Pritzker and the Illinois Department of Public Health deployed these resources to us. Most people are in and out in less than 30 minutes. More than 20 nurses, 60 soldiers, and 3 in the command structure work to give Rock Island County residents access to this life-saving vaccine. The team has given about 8,000 doses so far. The Rock Island County Health Department supports this mission by providing a site manager and at least 2 healthcare providers from either our staff or our Medical Reserve Corps. We are working 6 days a week to get our county residents vaccinated. We understand that the process for registration for this clinic hasn't gone as smoothly as we would like. We are working to get registration links available earlier, but we have to wait for the vendor to approve our clinic link request. Earlier this afternoon, we posted links for this week's Thursday, Friday, and Saturday clinics. Most of Thursday morning is reserved for seniors who registered through our partnership with Alternatives. Our goal is to get links posted several weeks out so you can schedule your second dose right away, but we don't have control over when the links are created. We ask that you pay close attention to our Facebook page and our website to see when new links are available. We all want a set schedule for posting, and we will continue to strive for that. Until then, please check those sites frequently. We created a video on Monday that explains this process step by step. It is available on our Facebook page, our website, and our new YouTube channel. To find it, search for Rock Island County Health Department on YouTube.com. Both Dr. Anthony Fauci and our own Dr. Louis Katz says that the best vaccine to take is the one that's offered to you. That said, only the Pfizer vaccine has been given emergency use authorization for people ages 16 and 17. Neither the Moderna nor the Johnson & Johnson vaccine have been approved for anyone younger than 18. We will post which vaccine is available at the clinic each day. This week, the clinic for the rest of the week will have Pfizer vaccine, even though the information with the link says Moderna. We had a last-minute switch. One last thing, please make sure that you eat and drink something before getting your vaccine. Having a meal before the vaccine could help those with a history of fainting, and water prevents dehydration. Thank you.
In recent days, we have had the opportunity to review our vaccine rollout and see how far we have come since the first vaccine was received at the end of December. Scott County started with 1 vaccine source, the Iowa Department of Public Health, and 1 vaccine, Pfizer. Less than 4 months later, there are 3 approved vaccines coming into our community, and these vaccines are coming from multiple sources to a variety of partners. Local pharmacies Hy-Vee and Maine at Locust are receiving vaccine directly from the federal government through a national pharmacy partnership. Community healthcare is receiving federal vaccine through an initiative for federally qualified health centers. And lastly, Our department continues to receive vaccine from the state health department, and this is the supply that we are giving to local healthcare providers. In Scott County, these partners have assisted in providing more than 59,200 doses of vaccine. We now have more than 18,700 residents that have been fully vaccinated. While supply has increased, we know it is not yet plentiful. Those days are coming. In the meantime, as we receive additional allocations of vaccine, we will continue to work with our partners to get vaccine where it is needed and where it can be put in the arms of community members quickly. Some weeks, that means scheduling a one-day vaccination clinic at our Sears location. Other weeks, it means providing additional doses to community partners to help in other ways. Throughout this time, we have used portions of our vaccine supply to continue vaccinating priority groups qualifying in Iowa's Phase 1B tiers. If you're vaccinated at our Sears clinic and receive an email, sign up to schedule your second dose, please do not share this link with others. It is very important that we vaccinate individuals needing a second dose at our second dose clinics and individuals needing a first dose at our first dose clinics. Because supply is not yet plentiful, getting vaccinated at the wrong clinic can make getting your second dose even more challenging. While we want to get the vaccine to as many people as possible, we want to do it the right way and ensure that each person receives his or her second dose in a timely fashion. For many in our community, it is your turn to get a vaccine. If you haven't yet made a decision on whether you will be vaccinated, now is the time to make up your mind. Ask your healthcare provider for medical advice. Reach out to your local health department or learn more on our websites. Browse the thousands of pages the CDC has on its website about COVID-19 vaccines. Talk to family members or friends that you trust and learn why they chose to be vaccinated. The incredible thing about vaccines is that they not only protect you, but those around you. We are so grateful for the vaccine science that will help end this pandemic. Thank you.
Thank you, Janet and Amy. Appreciate those thoughts for today. Media partners on the call, if you have any questions, please type those into the chat. We did get a question ahead of time that I want to make sure that we bring up on here, and this is for both counties. So maybe we can start with Janet for Rock Island County. What have the recent testing numbers been? The demand for testing has dropped significantly, but do you have any numbers of how many people are getting tested daily or weekly right now?
So that data is not available at the county level from IDPH. It is available at the regional level. And if you search IDPH COVID statistics on Google, and you will find, if you look at testing, we are in region 2. I would say that the reason for decreased testing is probably because people are so focused on getting the vaccination at this point. So some emphasis has dropped from testing. However, we know that robust testing, continued contact tracing, and strong vaccination uptake together will be what ends this pandemic. However, even after widespread vaccination, we will have a need for testing and contact tracing because none of those vaccines provide 100% efficacy against an infection. In studies, all the vaccines were shown to be highly protective against severe illness and death.
In Scott County, we are able to see the tests that have been reported to the state health department. So over the last month, we have been averaging about 2,000 tests per week, which is down from the 5,000 that was happening in November. I think it's important to remember that while people get tested because they are sick or because they've been exposed to somebody with COVID, there's other reasons that people get tested. They may be going on a travel, they may need to have a procedure and a local medical provider is testing them. There's circumstances at long-term care facilities where residents and staff need to be tested on an ongoing basis. So we will continue to see testing occur in our community.
Thank you. Janet, one question here for you. Did you say 8,000 doses had been administered at the Camden Clinic?
I said that 8,000 doses have been administered by this team. There were a few outside clinics that we did also with the help of the National Guard. So as far as the total vaccination with this team, it's about 8,000.
Thank you. Okay, it looks like no additional questions for today. We'll go ahead and conclude today's briefing. Just due to not a lot of new information to share with you that we're seeing this week, we are not planning on having a second press briefing later this week. So our plan is to talk with you all again next week. If anything comes up in the meantime, we know we will be sending you information through a press release or through other communications, so please be watching for any of that should it be needed. Otherwise, thank you again for joining us as you always do and for sharing this information with the community. We're extremely grateful for your continued partnership, and we wish you all a great rest of your week and weekend, and we'll talk with you again next week.